Hello, my name is Dr. Pasquale Cancelliere. I'm the physician owner of New Hampshire Foot and Ankle Specialist, located at 25 Buttrick Road in Londonderry, New Hampshire, and Massachusetts Foot and Ankle Specialist, located at 53 Main Street in Somerville, Massachusetts. Today, I want to spend a couple minutes with you talking about how diabetes mellitus affects the health of our feet. Diabetes mellitus is essentially a disease that results in impaired sugar metabolism, which results in chronically and varying degrees of elevated blood sugar in our body. This eventually results in peripheral neuropathy, accelerated peripheral arterial disease, and in the worst case scenarios, diabetic foot ulcerations and Charcot arthropathy. Diabetes mellitus continues to be the #1 cause of non-traumatic lower extremity amputations. And the reason why this is such a dire fact is because the 5-year mortality of a diabetes-related lower extremity amputation is worse than the 5 most common cancers, including breast cancer and prostate cancer. Because of the severity of the complications of diabetes on the feet, we have created a comprehensive diabetic foot program that consists of a comprehensive focused evaluation. All our new patients receive a series of digital x-rays of the feet so that we can follow any changes in the architecture of their feet, non-invasive arterial testing, and non-invasive neurological testing if it's needed. And this is because we want to prevent development of the problems when we can. But also, we believe that when a patient does have a diabetic foot ulceration, it is very important to be very aggressive about understanding what is causing the ulceration and what we need to do, what treatment plan we need to implement to heal the ulcer as soon as possible. We take a comprehensive approach and look at the entire patient. We don't just treat the feet. Sometimes I think as specialists we forget that there's another person attached to the part of the body that we're examining or that we're a specialist and experts of. But we look at the overall quality of health of our patients. We examine their nutritional status, their overall health status. We keep in constant communication with their primary care physician. But also we want to make sure that we're not missing on some underlying problem that's either worsening or causing the problem. A lot of times we can recommend minimally invasive and safe treatments that can treat the underlying cause and heal the ulcers uneventfully. But in some instances we do have to be more aggressive, and thanks to our comprehensive approach and the program we have in our practice, we're able to deliver that highly effective, safe, and minimally invasive treatment options to our patients. We have a state-of-the-art full office surgical suite, and a lot of times we can provide a debridement of the ulcer that day in a clean, safe, sterile environment. And we have also started a stem cell program that is used in treating a lot of foot and ankle problems, but we have found very promising results with our ulcers. We are able to cut down the healing time and the rates of infection and hospitalization by having this stepwise approach of comprehensive examination, thorough and effective debridement of the wound, and then implementing or delivering stem cells to the wound in order to trigger the body to be able to heal itself more effectively. So if you or a loved one are suffering